Welcome to the Actuate Health Faucet, a transformative initiative dedicated to empowering individuals with the principles of sustainable One Health. This program recognizes the interconnectedness of animal, environmental, and human health. Affirming a holistic approach is key to well-being. Our program is designed to equip individuals with essential health knowledge, enabling them to become stewards of their own well-being. Our hybrid learn sessions conducted fully via Google and physical locations. We engage participants from diverse backgrounds. These weekly sessions serve as learning, discussion, and collaboration. We focus on the co-creation through the Learn One, Do One, Teach One approach. This method ensures that each person has knowledge needed to improve their health for all. Together, we can make a difference. Welcome to the Actuate Health Access Faucet, a transformative initiative dedicated this program recognizes the deep interconnectedness of environmental and human health, affirming the holistic approach to well-being. Our designed to equip individuals with essential knowledge, enabling them to become the co-creation Learn One, do information, but also applies it.
Hii stuff isikuja kunitoa walai.
Needed to improve their health of their community full way. Welcome to the Actuate Health Access Faucet, a transformative initiative dedicated to empowering individuals through the principles of sustainable one. Affirming that a whole participants of diverse backgrounds. These week's sessions platforms for learning, discussion, and collaboration. We focus on one approach. This method ensures that each participant has valuable health information, also applies it and teaches it to others. Gain the tools and improve their health network. Welcome to the Actuate Health Access Faucet, a transformative initiative dedicated to empowering individuals through the principles of sustainable One Health. This program recognizes human health, affirming that a holistic approach is key to well-being. Our program equips individuals with essential health from diverse backgrounds. These sessions serve as platforms for learning, discussion, and collaboration. Focus on creating education. By participating in Actuate Health Access Program, individuals gain the tools and knowledge needed to improve their health and the health of their communities. Our goal is to create a network of informed health custodians who address health challenges in sustainable and join us in this journey towards better health for all. Together, we can make a difference. Welcome to the Actuate Health Access Faucet, a transformative initiative dedicated to empowering individuals through the principles of sustainable health. This program recognizes the deep animal, environmental, and human health, affirming that individuals with health knowledge, enabling to become custodians of well-being through our hard learn to earn sessions. We engage participants from diverse platforms for learning, discussion, and collaboration. We focus on the learn one, do one, teach one approach. This method ensures that each participant also applies it and teaches it to others, fostering a ripple effect of empowering education. Health and the health of their communities. Our goal is to create a health access faucet, a transformative initiative dedicated to empowering individuals through the recognizes the deep interconnectedness of animal, environmental, and human health. Engage participants from diverse backgrounds. These weekly sessions serve as dynamic platforms for learning, discussion, and collaboration. We focus on the creation of knowledge through the learn do one, teach one approach. This method ensures that each participant learns health information, but also applies it and teaches it to others, fostering a ripple effect of empowerment and education. Participating in the Actuate Health Access Program in an impactful way. Join us in this journey towards better health for all. Together, we can make a difference. Welcome to the Actuate Health Access Faucet, a transformative initiative enabling them to come to well-being through our sessions conducted both virtually via Google Meet and
Hello, everyone. We should get started. Do you hear me?
Yes, Dr. Ali. Good evening, everyone.
Mhm.
Welcome to our today's session. Over our last few classes, we've discovered that financial barrier is the greatest obstacle to accessing health services, and we've discovered that quadratic funding presents a promising solution to this challenging issue. So today we are going to discuss a critical topic, that is quadratic funding in prenatal care. We want to see how uh, um, quadratic funding can help improve prenatal care access. First of all, why is this prenatal care important? It is vital in ensuring that the health and well-being of both the mother and the child, yes, and that you see, during pregnancy, when expectant mothers go for regular checkups, the healthcare providers are able to monitor the development of the fetus, identify and manage any potential health issues. So, but sadly, many mothers are unable to get adequate prenatal care due to financial barriers. And of course, this leads to tragic outcomes. It is estimated that about 287,000 women die annually from pregnancy-related complication. And of course, lack of access to prenatal care is the major contributing factor. So before we start our discussion, let me take you through the meeting agenda. We will start by topic presentation by our topic master, Alan Owino. After that, we will get to hear additional comments from our CEO, Dr. Macharia Waringi. Thereafter, we will have an interactive session. Let's share the insight, comments, ask questions about the topic. And then thereafter, we will conclude the meeting. I would encourage active participation. Let's learn and share our insights. So at this moment, I will welcome our topic master to share more about our topic. Alan Owino, welcome.
Okay, thank you. Hello. Hope everyone can hear me.
Yes, we can hear you.
Okay. I'm called Owino Alan Victor. Currently a student at Moi University, taking manufacturing, industrial and textile engineering. So today we are going to look at quadratic funding in prenatal. So before we can even define what is quadratic funding, any person, I need to have an interactive class if I can give my definition. Anybody who knows what is quadratic funding, you can come on board and tell us quadratic funding. Hello.
You want people to raise their hand, or they can post in the text box, chat box?
They can just raise your hand.
Mhm.
Anybody?
I think they are waiting for you to teach them.
Okay. Let's go straight to quadratic funding. We need to know the definition of quadratic funding. So, quadratic funding is a type of matching grant program that incentivizes collaboration and innovation among organizations. So it works by providing funding to projects that demonstrate exponential growth in their funding over time. So in other words, the more successful a project is, the more funding it receives. That is quadratic funding. So let's look at the key principle of quadratic funding, the key principles of quadratic funding. So first of all, we start with matching contribution. So contribution from individuals, donors, are matched by a central pool of funds. Then after that, amplifying the impact of each contribution. Number two, quadratic scaling. So the amount of matching funds received scales quadratically with the number of individuals' contribution. So this means that projects with broad community support receive disproportionately more funding. Number three is decentralized decision making. So the community, rather than a centralized authority, decide which projects received fundings through their individual contribution. So, before quadratic funding, there was this model which was called traditional funding model. So we want to know what is the difference between the two, or what are the difference between the two funding. So first of all, in traditional funding heavily relies on large donation from a few sources. But when you come to quadratic funding, it usually prioritizes projects with widespread small contributions, reflecting broader community support. So in traditional funding, projects might be selected based on the preferences of major donors, not necessarily reflecting community needs. But when you come to quadratic funding, it reduces the disproportionate influence of wealthy donors, democratizing the funding process. So, we must also look at the benefit of quadratic funding. What are some of the benefits of quadratic funding? Number one, equity. So quadratic funding promotes fairness by giving a stronger boost to projects with the broad community backing. Number two is inclusivity. So quadratic funding encourages grassroots efforts and allows smaller organizations or initiatives to compete effectively. Number three is transparency. So the allocation process is transparent as contributions and matching funds are publicly visible. Number four is efficiency. So resources are directed where they have the most impact based on community preferences. So we are going to look at application of quadratic funding in prenatal care. Prenatal care is refers to the medical care and support provided to pregnant individuals during their pregnancy to ensure that the health and well-being of both the mother and developing fetus. So let's look at the application now of quadratic funding in prenatal care. Number one, reducing disparities. So prenatal care is crucial for maternal and infant health. However, disparities do exist, particularly affecting families of color. So quadratic funding will help address these disparities by ensuring that community-led initiatives focused on prenatal care receives adequate support. Number two, community-driven solutions. So this quadratic, by involving, it involves local communities. Quadratic funding can identify and support innovative solutions tailored to specific needs, such as improving access to prenatal services, maternal, mental health support, and telehealth option. That is mobile prenatal choices. Number three is state policies. State policies that promote birth equity, such as expanded Medicaid medical eligibility, higher minimum wages, and refundable state and income tax credits align well with the principles of quadratic funding. Before we can maybe come into conclusion, I want us to go through a case study of implementing quadratic funding in prenatal care. So imagine imagine a rural community with limited access to prenatal care. So here's how quadratic funding can be applied. We start with the proposed stage now. So the community members propose projects like mobile clinics, educational programs, or supplement distribution. Let's now look at the contribution base. So the residents contribute small amounts to their preferred projects. After these residents contributing small amounts to their preferred projects, they now come to matching funds distribution. So a matching pool, perhaps funded by larger organizations, uses the quadratic formula to distribute these funds project with the more individuals' contributions receiving more matching funds. So now after that, what now is the implementation of the impact of now the quadratic funding. So the funded projects are now implemented, improving access to prenatal care. So the outcomes are monitored to ensure better health for mothers and babies. So in conclusion, quadratic funding is a unique approach which democratizes resources allocation, ensuring that projects with broad community support receives adequate funding. In the context of prenatal care, this means that vital services can be provided based on actual community needs, leading to better health outcomes. So far, so good. I've come to the end of the topic. If there is any question, you can raise. Thank you.
Thank you, Alan, for that educative presentation. We've really learned. So in case there's someone who has a question, you can direct it to the chat box. We will address it later. Now I will welcome Dr. Macharia to give further remarks about the topic. Dr. Welcome.
Thank you, Glory. Thank you so much, Glory, and thank you so much, Alan, for now reminding us more about the beauty of quadratic funding. Quadratic funding is from many to many. The traditional funding is from a few to many, which is what was creating so many problems in financing, from few to many, because only a few people are privileged to provide funding. Yeah, whereas many are left unprovided. So Glory, did you say there is 287 women who die every year, every day? Who die because they're pregnant?
Over 287,000.
287,000. So it's not 287. In Kenya
Yes.
alone. In Kenya alone.
Yes.
Per year or per what?
Yeah, annually.
Every year.
Yes.
Wow. When a woman dies when she's pregnant, it's not one person who dies, two people die. Have you, can you all believe that? Two people die at the same time when the woman dies when she's pregnant. So it's not 287,000 people who die. It's 287,000 times two. That comes to what? For those guys who do mathematics. Now I know you know mathematics, Glory. How much is 287 times two?
I think 574,000.
Can you believe it? 574. What is that fraction to a million people? Is more than 500,000 people in Kenya. We lose more than 500,000 people every year because of our sinful nature, let's say, because of the inequities of ourselves. Those are people who should not die, and they die. And if somebody was to be open to you, particularly people in the healthcare industry, they know that those people die because of lack of access to care, because of lack of funding, lack of money. Lack of money is equals to death. So that dead capital that we have in Africa is not only dead capital as capital itself, it is equals to death of human beings. Human beings who are not yet born, plus human beings who are already born. It's very sad stuff. That those are people who, if they were born, those 287 new people could have been born, could have become the best scientists, best doctors, best lawyers, best engineers, and we allow them to die because of what? Because we have this old traditional finance system, which is made by egregiously selfish people. They don't want people to have access to care. Because they don't want people to have access to care, they keep on creating conditions where people are going to die. That's unacceptable. So you see, in Western civilizations, talking about United States, Europe, European Union, no woman dies because she gets pregnant. So for a woman to die because she got pregnant, it's unheard of. And if a woman dies when she is pregnant, a lot of investigation is conducted as to what is the cause of death, including trying to find out who must have killed that person. It's a crime to allow a woman to die because she got pregnant. When the woman is bringing life on earth, then she dies. It's a contradiction. So we have more than 500,000 lives lost every year because of this, because of pregnancy alone. And yet pregnancy is not preventable, and it's a desirable thing to have pregnancy, because it is by pregnancy that the human race is replenished. See? So we have a divine order to reproduce, to make babies. What if making babies means death to you? It's very, very scary. And so, and because we cannot finance it. So, Mrs. Margaret Kenyatta, the first lady of the yesteryears, the previous administration in Kenya, had created something called Beyond Zero campaign, where she was, she had this mobile clinics going from village to village. But the financing model was from the old traditional financing system, that without Margaret Kenyatta, then Beyond Zero is zero. It's not Beyond Zero, it's zero. It stays at zero. Maybe let's say it's not even zero, it's minus 287 women dying every year, which means minus 847 people dying every year. That is what it's not beyond zero, it's minus 847 deaths. You see, that was a great effort by Margaret, but the financing model was wanting because it is from her to the people instead of from people to people. It's not peer to peer. It's not person to person. It's not distributed. So it has no equity. Now quadratic funding makes that problem go away. Where now funding is not from, the first lady to everybody else, but from every lady to every other lady. Okay, that's peer to peer. That's what I would love you guys to appreciate. We don't have to wait for Mrs. Ruto to roll out Linda Mama because we know all the vagaries of that family. In the process of creating Linda Mama, she's going to be stealing as much money as possible to line her pockets. But we are talking about every person involved in guaranteeing financing for the health access for everybody. And this is what we want to implement in our health access program. You see, this is at the heart of the health access. So that by next year now, 2025, we are rolling out quadratic funding platforms. And it is easy to do it so long as we put up the technology properly. Because it's technology for participation, that every person in the community participates in financing the health access. And you see, at the granular level, say when everything is said and done, health access is mobile clinics, just like Margaret Kenyatta had conceived it. The only thing that was not conceptualized is the funding process itself. She had to go and run marathons herself alone, maybe with other people, and then they donate money in her name so that she can fund the Beyond Zero. But with quadratic funding, you don't need all that. You don't need just one first lady by herself alone being the poster person so that money can come out. Is that people they have money. The biggest question is how is that money governed? Because of course you don't want Mr. Ruto governing that money. You want people governing the money themselves, peer to peer. Blockchain has made that possible. As Mr. Wino has explained to us, you have local people in a community, for example, and what we're going to be doing next year, when we are ready, our platform is ready. Is first of all, we're going to be building a platform during the month of August, and we'll keep all of you informed so that you can know and you can see how to participate. And the platform itself is for distributing Actuate tokens by manner of buying. If you buy the Actuate token, you are contributing to the funding process. So when people buy this Actuate token, then we look for big donor investors, donor philanthropists, to match the amount of Actuate tokens that have been bought by local people. For example, this Actuate token they'll be buying the Actuate token to raise money to buy a mobile clinic. A mobile clinic that is well equipped, even with community health workers attached, and prenatal care nurses who are also within the mobile clinic system. That this clinic would be probably driving to every community, just like Margaret Kenyatta had conceptualized it in Beyond Zero. And then also for small clinics in the village. And you see, every community can raise money for its own clinic. And from research work we have done in the past, we know that a clinic, full-fledged clinic where you can do proper prenatal care, but then also goes to do labor and delivery that has a small theater unit for cesarean sections, wouldn't cost more than $10,000. You see, that's very, very cheap. But it's possible to do it. But when people don't have resources, or the resources are not organized, then that can look like a lot of money. $10,000 is something like about 1 million shillings, or maybe 1.5 million shillings. That can look like a lot of money when a person is alone, but it's a very little money when many people are working together. So, and that's what we're going to do, that we create a platform where people can contribute money, donate. And when they donate money, then the big donors, we're inviting big donors. We're doing a huge campaign right now to create awareness among the donor community so they can see what is going on. So that when the quadratic funding platform gets ready, then all they have to do is to donate money by buying Actuate tokens, by the way. You buy the tokens, and those tokens, the money they use for buying tokens is used for building clinics and mobile clinics, like mobile clinical centers. So that is why quadratic funding is very powerful. So Beyond Zero campaign, the Beyond Zero, now does not say Beyond Zero. It is called, we should have it from 0 to 1. It's Beyond Zero in a real sense. That now we're not talking about zero. We are now have got the numericals. Like we are already number 1, number 2, number 3, and we start building clinics that way. And then you have access to care, because it helps to decentralize the funding process. There's community participation, and when it's peer to peer, that is from many to many instead of from few to many. Then we have equity. Equity means people equally contributing, or equal participation. And when they equal participation with everyone in the community, people fall in love with their own project and they'll protect it because it is their own. And this, when you think about prenatal care, you want to think about the situations, the circumstances before conception, because prenatal care begins with the conception. It's conception of baby. Majority of women in Kenya, they don't know they have conceived until maybe 5 weeks after the baby was conceived. See, they don't know because there is no system that would enable to gather that information. But I know in European countries, women know that they are going to conceive, almost planned, particularly in France, a very, 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 you could say, very intelligent system, a healthcare system. So the healthcare system should know when the majority of the women are going to be conceiving. If they can't capture that information, at least they should capture it when the women miss the first period, the last menstrual period. If we don't have somebody following up and women are not reporting, then women can miss the period, but then people in the healthcare system do not know that the woman has missed her last menstrual period and if there's pregnancy in progress. You see, prenatal care must begin at the very, as soon as the woman misses her last menstrual period, okay? Because the baby, a new life begins to form. And so that at that time, a woman needs to have clinical appointments, at least to be seen by a doctor every month for the first 3 months. And then after that, and the second 3 months, second trimester, let's say, should see a doctor every 2 weeks, and then eventually in the third trimester, almost every week. And in that, where they're not just seeing their doctor or maybe a clinical provider, they're getting to be evaluated how the pregnancy is progressing, so that the clinical provider can detect whether this lady is able to carry the pregnancy to term, or she has risk factors that may prevent her from being able to carry the pregnancy to term. And if the risk factors are identified, then the providers will know what to do to prevent loss of pregnancy, see, or even the loss of the mother. So a lot of women die because they stay at home and the pregnancy just grows and grows and grows. And then they don't know what kind of risks they have. Okay? Then by the time they come to term and the baby is about to be delivered, maybe the baby is too big. It's too big, so it cannot come out. It can get impacted labor. But some of them, even before they get there, the baby could be having problems. The pregnancy could be affected by so many things because pregnancy causes so many changes in a woman, and those changes have to be monitored closely to make sure that the woman is able to carry the pregnancy to term. And the things that kill women are totally preventable because pregnancy is not a disease. See, pregnancy is not a disease. Pregnancy is a healthy process, and so long as it is seen as healthy, then the woman will carry the pregnancy very well to term. One of the greatest cause of maternal death is lack of food. Some impossible to believe, lack of food, good nutrition. That if the woman is not eating well, then of course the baby is not going to be growing properly, and then she will not have enough energy to carry the pregnancy term. And she, first of all, if she's not eating well, maybe she was also predisposed to lack of food before. She was having stages, malnutrition, starvation. So the body is not strong enough to carry that pregnancy term. So food is very, very important to carrying pregnancy term. And then the other minerals, things like iron, minerals, just basic minerals, folate, which are available, but you wouldn't know. So you wouldn't know whether you don't have enough iron or enough folate or something like that unless it is checked by somebody clinician. So those things are not very difficult to obtain. Even say they can come as tablets or they can come in as what? As you can eat sukuma wiki, it's got a lot of iron, or liver, just changing the diet. You see, all these dietary changes that a woman needs to have, she may not know. She doesn't know because nobody told her. And then it comes, the pregnancy, it comes and gives her trouble. And if some of those things are missing in the diet, the baby can be born with malformations. So nutrition, very important. And of course, also the living conditions for the women. And then of course, exposure to infectious diseases. Women, when they're pregnant, the immune system drops down. Why does the immune system drop down at the most necessary stage? Because they have increased blood volume. There's a lot of water in the blood because they want to have a lot of water, blood volume. And when the blood volume increases, that dilutes the blood cells. You see, if you add more water to a system, you reduce the concentration of whatever was in there. So there's dilution of the blood itself. When the blood is diluted, it means that you don't have enough concentration of the cells that protect the woman, of the antibodies that protect the woman. So parasites like malaria, which, malaria parasites, which were not causing disease when the lady was not pregnant, start causing diseases when she gets pregnant. So malaria kills many pregnant women, because initially when they are not pregnant, when the woman is not pregnant, she gets mosquito bites. The mosquito bites do not result in malaria, which is in fever, but the body is able to fight it. When she gets pregnant, it's not the same story because the blood is diluted. You see, and these things are preventable because if there's good clinical follow-up, somebody will know that this is what an infection happens like malaria, then gets treatment very rapid, very quickly before it causes problem. Then you see there's so many infections like that becomes much more prevalent because the woman is pregnant, and they cannot be treated if, they're going to result in death if they are not treated. Then you have chronic diseases like high blood pressure. or diabetes of pregnancy. There's some women develop high blood pressure when they're pregnant, and I don't know why that happens. Maybe it's just the body's reaction. Others develop high blood sugar. So there are chronic diseases like that. And then other chronic diseases could be in the body, even infectious diseases like tuberculosis. They can become active because the woman has become pregnant just because the immune system has dropped down. Cellular immunity is not as strong. That's why you have this large population of women dying because they get pregnant, because they become very, very vulnerable, not only to infectious diseases, but also to the non-communicable diseases like high blood pressure and diabetes and, and the like. It's why this quadratic funding makes it possible for all those things to go away. So I think as we go along with this conversation, first of all, is to create awareness. Like quadratic funding is going to be very, very powerful. We're able to go beyond zero in real sense. When Margaret was talking beyond zero, she was talking about beyond zero, which is equals to 1, which is herself. So the beyond zero we are talking about is beyond zero to plurality. Plurality. Peer-to-peer, many people, not one person. So we don't want to go beyond zero to one person. We want to go beyond zero to millions of people together. Blockchain makes that possible in the quadratic funding formula. And then when that money is contributed, then you will see all the people in the project are able to participate in making decisions about the allocation of that money. Okay, how the money is allocated. Because you will see when we create this, about allocation itself, is that people choose or they vote. It's a democratic system. People vote with their tokens that this is the proposal we'd like to implement. For example, when we create the platform, we're going to have a document describing the project itself, and the project will be, say, like the project point is going to be is going to be implemented with a few choices, and then people can vote with their tokens. Okay, your actual token is your voting card. So it means that because everybody is holding their tokens, keep your tokens very safe, okay? So that when that time comes, you will be able to use your tokens to vote for the projects themselves. On the platform on our website, it's going to be on actuate.bio, okay? And that way we go beyond zero, not beyond zero to one person, beyond zero to many, many, many people, millions and millions of people, to the plurality, so that we can now beginning when this quadratic funding takes shape, and we shall check the impact of it 5 years down the road and see whether these numbers have changed from 287, which is 540, what? 564, 574 to something so much less. We would like, first of all, to cut down the incidence of that death, maternal death, by half every 5 years until the incidence of maternal death come to zero. And I believe that in 10 years, with quadratic funding for maternal care, for prenatal care, the maternal death or death of women during pregnancy will come to zero. That unless death is totally unavoidable, it's coming due to a natural disaster, there is no pregnancy that should kill a woman, because pregnancy is not a disease. Right? Well, that's what I would like to say about that. But we're going to take some very serious heavy lifting for all of us to work together to make sure that beyond zero is not beyond zero meaningfully, to beyond, it becomes to be beyond, not beyond 0 to 1, to beyond 0 to millions of people participating, not one person participating in financing. All right. Well, thank you so much. Back to you, Glory.
Thank you, Daktari, for those insightful remarks. indeed, no woman should die while giving life. So let's spread the word about the importance of prenatal care and how this innovative funding model, the quadratic funding, let's spread conversations about this quadratic funding model and how it can make difference even when we will implementing the this funding model come August or few months from now. Let's make sure that let's spread the word. Let's make sure that many people are aware. Let's bring many people on board to learn more so that when we will be implementing, it will be easy. So now I will welcome any questions, any comments, any insight from the topic. I encourage us to be interactive. It is an interactive session. Share what you think about the topic, what you think should be done. Ask question. Yes, you can raise your hand to speak, or you can chat.
Hi.
Hello?
Hello.
Yes.
Yes, I have some contribution here
Yes.
concerning with the topic of today.
Mm-hmm.
Yeah, as you know that for the issues of improving disciplinary care in health facilities, is the issue of technology in medical treatment are improving for the maternal well-being. I can add on how this technology that have been improved by engaged with different stakeholders to bring the crucial role in enhancing prenatal care. So I can say it can bring a positive impact. As you know that nowadays we are in the process of inviting these sponsors and donors to come to the summit. So on the all issues concerning the technology. So the improvement according to this prenatal care, the using of telemedicines and some of the remote monitoring to enhance about access healthcare through through telemedicines, through regular checkup consultations and some of the monitoring that can be done in OCA or virtually. And this sometimes reduce some frequency in personal visit because the using of this remote monitoring device, such as track signs, fetal movements, and some of the contractions provide really time data to healthcare providers. This is just doing for the matter of telemedicines and the remote monitoring, according to technology, how to help in a crucial role in enhancing prenatal care. But another issue is all about mobile using for these mobile applications. We know we just have these pregnant applications that offer personalized informations, reminders, and using of this education content about the topic about prenatal continuation, those prenatal visits. They just provide about reminders. So they cover about the whole topic like nutrition, doing exercise, about issue of fetal development. So these applications, they just provide about the issues of contraction timers of infant of fetus. They just bring about these kiki counters. So it is like due to date, they just providing of these calculations. So it's like they are monitoring. But another issue, it is about using of this ultrasound technology. It's like an advancement one which has been used in different health hospitals to monitor about the fetus development, which can provide about details for visualizations of this fetus. So by doing this ultrasound provide and clear images aiding in early detection of any abnormalities and assessing about this fetal growth. So this is how this technology help by using this quadratic funding, which can help the community to change their mind from those traditional ways that they are using in enhancing this prenatal care. But another issue of genetic screening and testing for those who need to use it's sensible because they just wanted to assess about this genetic risk. By doing so, it is how we analyze about this fetal DNA from the maternal blood, detecting any chromosome abnormalities like Down syndrome, you see. So this is used like a safer than the invasive procedures like amniocentesis. But another issue that technology, how can it help this about the prenatal? It's using of these electronic health records, which is streamlining the patient information and making it accessible to healthcare providers across the different settings. And it sometimes can ensure about the continuity of care and reduce about the applications of tests. But also another issue of educational videos through online. People can go to those platforms offering about healthcare educations, about prenatal development, like childbirth, parenting. So these resources can empower expectant parents to make informed decisions about their pregnancy. In addition to that, as Dr. Mashari has been said, monitor about those fetal heart rate has explained it deeply. Issues like portable Doppler devices. This allows like parents to listen, doctor to detect about the fetus heartbeat. So it's used to detect about how the fetus is going inside the womb of the mother. So by doing this, it is monitoring and providing the assurance of the baby. But also there's other applications that provide about nutrition and fitness. This can help to track maternal weight gain, nutrition intake, and exercise routines. So all of this, they promote about health habits during pregnancy. But in summary, we can say like this technology should be complement, but in order to replace about this human interaction. But prenatal care remaining collaborative effort between expectant parents and the healthcare providers in association with these issues of quadratic funding, which will help to solve about these problems by inviting different sponsors or donors to support about this issue of prenatal care, if we just involving this issue of technology in order to use these tokens for the benefits of these pregnant mothers and their to improve the generations for the future. Thank you for contribution.
Oh, thank you so much. That was Damien. Thank you so much, Damien, for great contribution. Yeah, you have told us about telemedicine for prenatal care, and today we have a lot of technologies, and this is now what we would fit into those mobile clinics. Because if there's a mobile clinic or maybe a prenatal clinic somewhere out there in the village, it will not have sufficient human resource. For example, people can do, if we have these remote monitoring devices, they'll be sending data to a center, say like Nairobi, where people can be looking at that data and saying, okay, the fetal heart rate, even they say monitoring of the mother, the birth weight and her blood works, and then monitoring the fetus, all these technologies, and there's a lot of new technology. And I think these are some of the things we want to discover in the summit coming in Nairobi, to invite the companies that are making all this tech. And for example, General Electric manufactures handheld ultrasound devices that are the size of a pen, that you can do ultrasounds, but then it's connected to, you can now plug it into your phone. Just what they call it, just the finger for probing. It's called the probe. The probe itself is very tiny. You plug it into your phone using your phone jack, and then on your phone screen you can be seeing the baby, or the fetus in the ultrasound. So, but they're not distributing it because there is no platform. This is why we need this quadratic funding to gain access to such technologies made by many companies that, for remote monitoring of all manner of things during pregnancy. And those will be fitted into a remote clinic or a mobile clinic. So that's very good. I believe that we continue inviting people to the summit, so that even when you're now rolling out the quadratic funding platform, we know the remote monitoring technologies that are going to be there. Now, the electronic health record is very powerful, because when, say, for example, you take that ultrasound in the village using that device that is you can plug into your phone, then that ultrasound can be transmitted with electronic health record to the remote center. And even it's not going to be available just locally. It can be viewed by a center with which we have created agreement. Say, for example, Johns Hopkins Hospital in the United States can agree that we shall be reviewing the ultrasounds for your people out there in Laikipia village, a village in Laikipia, which is now, it means that the healthcare human resource becomes equitably distributed. That even where people don't have access to healthcare, then with remote monitoring devices, then we can have health professionals sitting remotely and helping to read the vital signs, to read the laboratories, the lab reports, for example, the blood works, to read the imagings, taken up by and put on the electronic health record, and to give their clinical advice. This is why is that this technology, now funding is the key. Funding is key, because if we don't raise money, then we can't build all that. That's why quadratic funding is very powerful. Going to be very powerful, because what has held us from getting it to that level, it's not the technology that is missing. It is funding innovation. We are not able to innovate money properly, but now we could not do that before. All we were doing is working with one individual, like the First Lady, to help raise money for the whole nation. You see, now we are talking about the whole nation raising money for the whole nation, or the whole continent raising money for the whole continent. All right, thank you so much, Damien. Back to you, Glory.
Thank you, Daktari. Thank you, Damien, for that contribution. I will read the comment. Oh, Grace says that was a nice presentation. I don't think there's any other question.
Okay, then we can move to the next. What's next? Go ahead. Hey, Glory, let's move to the next thing. Next item. I think Glory has dropped. Can't hear. Okay. Glory, maybe you're muted. So,
Sorry, can you hear me?
yes, you're back now. Mhm.
I muted by mistake. So, thank you everyone for attending today's meeting. I will encourage that when we learn something, let's share with our friends. Let's implement what we can, and let's spread the word about quadratic funding. Let's welcome more people to come and learn so that when we are implementing it, people are familiar. I mean, everyone, the community members, the locals. Yeah, let's leave no one behind. So I think the form has been shared on the chat. I will give you some few minutes to complete the form. So unless there's any other concern, maybe we can conclude the meeting.
Well, the other concern is about this. The summit is not a concern. It's just to keep reminding people. You know, our summit is December 3 to 6. And by that time, I think all this protest in Kenya would have dissolved. I believe so. And or maybe has quelled. But the summit is picking up pace. Now, if you go to our website, that is www.actuate.bio, and then you look the Nairobi Summit, then you look at speakers page, you will see a whole bunch of people are coming. They have agreed to come and speak. So don't miss out. First of all, you should submit your abstract, register to come and speak, or even your poster presentation. And so we have so many speakers right now. Some ordinary people, some others very prominent people in different fields, in technology, in medicine, and in society, let's say. So we have some people in policy. So the conference is taking shape. That's very, very encouraging. And so things are moving and moving at very, very high speed. Today, I was just speaking with a group called African Diaspora Network, which is here in the United States. These African Americans who try to promote investments in Africa. And I have told them about our summit. They are very excited. Yeah, African Diaspora Network. They have a very huge following on YouTube. I think they have a YouTube channel with about 1.2 million people. So this means that you're going to mobilize the African diaspora through that. And let me tell you, when African diaspora comes in, there will be no room for you if you're. That's why you want to reserve your spot as early as possible, because because African diaspora is not just Kenyan diaspora. We're talking about African diaspora. These are African Americans who came to the diaspora way back when. We don't know when, like hundreds of years ago. Those are very many. And then we have the other continental African diaspora, people from other countries like Nigeria, Botswana, South Africa, say Egypt, whatever, everywhere in Africa. So African Diaspora Network has got all those people, and of course, people from the Caribbeans. Yeah, let me see, they are going to get the message about Actuate through that African Diaspora Network. So yeah, they're very excited about it, and they have to be, first of all, because they are a news channel, you could say a newspaper for the African diaspora. It is likely to build a very huge impact for our summit in Nairobi. Yeah. So this means work is moving at very high speed, and of course, as we talked about, you see, I think when it comes to now our quadratic funding platform, the African diaspora itself will provide the matching funds as we are talking. So we should be able to mobilize capital to build facilities in so many different quarters. That's another thing. If you do not have actual tokens you're accumulating, actual tokens are likely to become very, very expensive. So the are ones you're receiving for attending this, but that's the baseline. You want to go to the market and buy actual tokens yourself, so you can be holding for yourself. Because when now this thing takes off, when now see African Diaspora Network is talking about Actuate, and then you can see Actuate gains attention to a very huge population. Okay. All right. That's one of the things that, you know, it's one of the things about these tokens that you will receive your tokens. Part of that is to learn, to help you learn how to manage your tokens so they're not stolen. Of course, when you talk about tokens, they go into your wallet. So I'm going to emphasize again, when you have your wallet, when you're you're installing your wallet, you download the wallet into your phone. The wallet gives you two things. One thing it gives you two things. It gives you a passphrase. This is called mnemonic phrase. That mnemonic phrase is sacred. By sacred means it's holy of holy, the holiest thing you're holding there. Okay? Do not share it with anyone. Not your friend, not your enemy. No one should know it. And you have to keep it secret. That's why I call it a secret phrase. It belongs to you in your consciousness. That is the mnemonic phrase. Then a wallet, it means for you a new wallet address. That wallet address is called a public key. It's your wallet address. That's public. You can share that with anybody so they can send you money. That is the only thing you're supposed to share. Your mnemonic phrase, you write it on a piece of paper. I want to reemphasize this once more. Do not save your wallet address into your Google Drive. And do not save your wallet's address. I mean, I'm talking about the mnemonic phrase or the seed phrase. Do not save it on your email, because your email or your Google Drive or whatever else, don't even save it in your computer, in your laptop. Just write it down on a piece of paper and you keep that paper safe. Okay. The best way to keep it safe is to go to town and laminate it. There are people who provide laminating services. You laminate that piece of paper so that it is with you always, and you can keep it somewhere safe. This is because I'm saying this thing because a lot of people lose their money. As Damien was asking, what are the challenges? The biggest challenge we have with the blockchain money is people not taking care of their wallet addresses, and their money gets drained. Okay, so people who can look at your friends, somebody who can be looking at like your friend, it turns evil when he sees money. Money has a way of converting human beings into small devils. Okay, so do not tempt them with any money. Look what has happened to our president. He saw some money, then he was tempted completely. Yeah, that is what happens. Then he starts salivating like a rabid dog at the sight of money. So that problem, it doesn't affect only our president, it affects human beings. The only person who is able to resist that, we are told in the Holy Scriptures, is Jesus Christ. Known as the third temptation. After he went fasting for 40 days in the wilderness, he was visited by the prince of the darkness, and he told him, listen, turn those stones into bread. Then he told him to go away. Then said, go up on top of a high building and jump down. Then you see God your Father is going to come and whoop you down like a Superman. Then he said, shut up, don't tempt the Lord my Father. Then the prince of darkness took him to a top mountain and told him, he said, hey, mister, you see all these kingdoms? They are mine. If you kneel down and worship me, I will give them to you. That's a third temptation. So you know that human beings are susceptible to the third temptation, including the most trusted one. So you do not want to tempt them, because with your money, because that temptation means that as soon as they see money, their eyes start glittering and they start salivating and they want to take your money. Okay. All right. So that you understand, that's why you're those three temptations. The third temptation is the worst. It affects the least of us and even to the greatest of us. Money is very, very tempting. That's why money is called filthy. Look, it's filthy because of the temptation it brings. Look, because it shines. It's a shiny, filthy thing. Feel the shining stuff. So when you understand that, you're going to take care of your seed phrases. So that your seed phrases. And of course, keep your devices safe also, because your device is your bank. But always put your device in lock mode, that if you're not using your device for 5 minutes, not even 5 minutes, as soon as you stop using it, it goes off. So that anybody who tries to come in cannot just swipe it and opens. They have to type in some PIN number to enter into your device. Now, even if they type the PIN number, your wallet itself must have another PIN. The PIN that you use to open your lock, to unlock your phone, must not, and I emphasize the word not, must not be the same PIN as for the PIN for your wallet. So your wallet has a separate PIN. You don't use the same PIN. And maybe the best way to do this is you need to have a system in your head so you don't get all these pins confused. So, for example, the Trust Wallet PIN requires 6 characters, but maybe your cell phone lock requires only 4 characters. Now, it is, so you know that 4 characters for the external PIN, 6 characters for the internal PIN. The internal PIN is your Trust Wallet PIN. So when you have a PIN, usually when you install a wallet, it asks you whether you want to create a PIN. Don't say no, say yes, you want to create a PIN. Okay. And then that PIN also do not share it with anyone. Maybe you can say your phone is using it with multiple people, that maybe you have a spouse can use your phone. So he would have to unlock your phone, but your PIN for the wallet must be different from the PIN for unlocking the phone. Make sure that is important. And then, the PIN is not the passphrase, it's not the seed phrase, it's not the mnemonic phrase. The PIN is not the same as mnemonic phrase. That is also another level of security. So if you have these 3 levels of security, then it will be very hard for someone to come in and steal your money. Remember, not your keys, not your money. If somebody has got hold of your keys, that means the public key and the private key, that means the seed phrase, then the money is not yours. It's gone and gone forever. Okay. The only way that you can get that money is look for a big hammer and go to that person and threaten to knock out his teeth with a big hammer. That is if you know who stole it. If you don't know, then you are in trouble. Okay. Well, that's about security, securing your own things, because the hackers are just local. They are not very far away from you. Like Waswahili says, and Mr. Damien knows this, kikulacho kinguoni mwako. Isn't that so, Mr. Damien? Kikulacho kinguoni mwako. All right, Mr. Damien is muted. Okay, you guys, I think that's it for now. I just wanted to say that, to emphasize that. Of course, All of you keep working hard, stay safe, and stay, stay curious, stay very curious, and stay hungry. Now, who said stay curious and stay hungry? Well, that was Steve Jobs. Stay curious and stay hungry. Hunger for knowledge, not hunger for food, hunger for knowledge. And of course, even the Holy One of Israel said that blessed are those who hunger and thirst for righteousness, for they shall be satisfied. Yeah, hunger and thirst for righteousness, and you shall be satisfied. Stay hungry and stay curious. All right, that is hunger and thirst for righteousness. All right, guys, you have a good one, and talk to you another time. And let's look out for the quadratic funding platform over the next several weeks. We're working on this inexorably, very, very hard. Okay, bye now.
So thank you, Alan. Thank you, everyone, for joining. So once you fill the attendance form, you are free to leave. Bye.